Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Evon Zoog. Today, I'm going to walk you through your consent form for liposuction. If you have any questions while reviewing this form, please enter them in the portal below, or feel free to ask them in person if you prefer. Let's begin with what this treatment is meant to do and what you can realistically expect. Liposuction is a procedure used to remove unwanted pockets of fat from specific areas of the body that have not responded the way you want with diet and exercise. It is designed to improve body contour and shape, not to serve as a weight loss procedure. In many cases, it can help create a smoother and more balanced appearance in areas such as the abdomen, waist, hips, thighs, arms, neck, or other selected areas. The best results usually happen when skin still has good firmness and elasticity. It is also important to understand that liposuction does not treat cellulite, and if there is loose skin, stretch damage, or reduced skin tone, additional procedures may sometimes be needed to help tighten the area. Now let me walk you through how the procedure is performed. During liposuction, I make very small openings in the skin and place a thin instrument called a cannula into the treatment area. That instrument is used to carefully loosen and remove excess fat. Depending on your treatment plan, the procedure may be performed with tumescent fluid, which helps reduce bleeding, improve comfort, and limit bruising. In some situations, ultrasound assistance may also be used to help break down fatty tissue before removal. Liposuction can be done on its own or combined with other procedures if that is part of your surgical plan. After surgery, you will typically wear dressings or a compression garment to help control swelling and support healing. Every surgery comes with important considerations, so let me go over the important ones with you. Like any surgery, liposuction does carry important risks to understand. These can include bleeding, infection, scarring, swelling, bruising, delayed healing, and discomfort during recovery. You may also experience temporary or sometimes longer-lasting numbness, skin sensitivity, or changes in skin color. In some cases, there can be contour irregularities, unevenness, asymmetry, fluid collections, firmness under the skin, or results that do not heal as smoothly as expected. Rare but more serious complications can include injury to deeper structures, anesthesia-related problems, blood clots, fat embolism, fluid imbalance, wound separation, skin loss, the need for emergency treatment or additional surgery, and other unforeseeable complications that I cannot predict. Smoking, nicotine exposure, certain medications, health conditions, and poor skin tone can all affect healing and results, which is why it is so important to review your health history honestly and follow instructions closely before and after surgery. It is also important to understand the potential benefits, along with the alternatives available to you. The goal of liposuction is to improve body contour by reducing localized fat deposits and helping clothes fit better and proportions look more balanced. For the right patient, it can create a more sculpted appearance in areas that have been difficult to change through lifestyle efforts alone. At the same time, liposuction is optional, and there are alternatives. Those can include choosing no treatment, continuing with diet and exercise, or in some cases, combining fat removal with procedures that also address loose skin. The best choice depends on your anatomy, skin quality, goals, and expectations, and we have reviewed those options together as part of your consultation. Before you sign, I want to summarize what your consent means. By signing this form, you are confirming that you understand the purpose of liposuction, its limitations, the possible risks, and the alternatives, including the option of no treatment. You are also authorizing me to perform the procedure we discussed, along with any medically necessary decisions that may arise during surgery to protect your health and safety. You understand that results can vary from person to person, that no specific outcome can be guaranteed, and that additional procedures may sometimes be needed. You also acknowledge that following your pre-op and post-op instructions is an important part of your outcome. This includes avoiding smoking and nicotine exposure as directed, taking medications only as instructed, attending follow-up visits, and participating fully in your recovery. You also understand that there may be financial responsibility for the procedure, related care, and any future treatment that becomes necessary. To summarize everything we discussed, Liposuction is a body contouring procedure that removes stubborn areas of fat to help improve shape and proportion. It is not a weight loss procedure, and the best results depend on factors like skin tone, healing, and following instructions carefully. We also reviewed that all surgery carries risks, that alternatives are available, and that additional treatment may sometimes be needed depending on healing and outcome. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.